Hi, I'm Anja from Hypnobirthing and welcome to today's video where I'll be talking to you about breast engorgement, how to reduce your risk of getting it and how to deal with it if it does happen to you. If you don't want to miss any of my weekly videos, please click the subscribe button and the bell icon so I can support you through your pregnancy, birth and postpartum journey. Breast engorgement is the development of swollen, lumpy and sometimes painful breasts, and it occurs when too much milk builds up in your milk ducts. Engorged breasts can feel really tight, hard and tender to the touch, and you might also experience some swelling under your armpits and your veins protruding on your breast tissue. Initially, breast engorgement can occur when your mature breast milk comes in and you stop producing colostrum. In the first week or two after your baby's been born, breast engorgement is pretty normal and pretty common. And it usually occurs because there's increased blood supply to your breasts and a boost in milk production. You might also experience engorged breasts if you've chosen not to breastfeed or you can't breastfeed for some reason, because your body will automatically produce breast milk 3 to 5 days after your baby's been born. Other causes of breast engorgement can be if you're not removing milk from your breasts regularly enough, or your baby isn't emptying your breasts during a feed. If you're breastfeeding, pumping or doing both, or maybe you've decided to introduce a few bottles of powdered milk in between a breastfeed, all of these schedule changes or changes in feeding patterns can cause you to experience engorged breasts because your body learns automatically. So if your body is used to being stimulated or used to feeding at a certain time and then your baby doesn't feed at that time, your body will temporarily get a little bit confused and produce that milk that then isn't used up, causing your breasts to be swollen. But over time, your body will adapt to changes in schedule. Initially though, it can lead to engorged breasts because you're over producing milk that isn't being used. So like me, you might experience a few changes in feeding schedule and you might experience engorged breasts as a result of this change in schedule. So schedule changes might be a result of a number of different things. For example, perhaps your baby's sleep schedule alters so they sleep through a usual feeding time. Also, you might return to work or leave your baby for a longer period of time, which coincides with a normal feeding time. And these circumstances can lead to engorged breasts if you're unable to express milk during this time. You might also experience breast engorgement if your child is teething, feeling unwell, or has congestion, as this can make it harder for them to feed successfully and empty your breasts of milk. Another reason for breast engorgement is if you're feeding more on one breast than another, or your baby is having a growth spurt and they temporarily stimulate your breasts more than usual for a while, then reduce the amount that they're feeding. So now let me share with you my top tips to relieve breast engorgement. Tip number 1, make sure that your baby feeds as long as they want to. Ideally, every breastfeed should last at least 20 minutes. And in the early weeks and months after your baby's been born, they should be feeding at least 8 to 12 times in a 24-hour period. So that's every 2 to 3 hours. Tip number 2, if you're pumping or hand expressing to build up a supply of stored breast milk in your fridge or freezer, be careful not to overdo it because it can lead to an excess in milk production and as a consequence of that, engorged breasts. Storing 1 to 2 extra portions of breast milk per day is perfectly okay to build up a decent supply, but you don't really want to be doing more than that because it can lead to breast engorgement issues. Tip number 3, if your breasts do feel engorged, before you feed your baby, take a warm shower, a warm bath, or if you haven't got time to do that, just placing a warm compress on your breasts can soften them and help your milk to flow out more easily. When your breasts are really swollen and hard, it can be harder for your baby to get a deep latch onto your breast, and it can be harder for your breast milk to actually come out, and your baby can get fussy and you'll experience more pain and discomfort as they try to latch on. So if you soften your breast tissue with a warm compress before that, it can help your milk let down to be more smooth and successful. Another tip for relieving breast engorgement is to massage your hard, lumpy breasts. So what I did when my breasts were engorged is just take 2 or 3 fingers and massage gently, but with a little bit of pressure, the lumpy bits until they became a little bit softer. And I would also massage all the way up under my armpit, and that helped to loosen the tissue and it allowed my milk to flow out more easily. You will struggle with breast engorgement if your baby doesn't empty your breasts fully, but also if you forget which breast your baby needs to feed off next. For example, when I was really sleep deprived in the early days after my daughter was born, sometimes I would forget that she fed off my right breast during her last feed, and then when I gave her her next feed, I would put her on my right breast again, and that would cause my left breast to become really swollen and engorged. So to avoid this, one of the best things that you can do is put an elastic band or a hairband on your wrist. So if your baby has fed off your right breast during the last feed, you would simply move that elastic band or that hairband onto your left wrist, so you know, okay, next time my baby needs to feed off my left breast first, and that can prevent you getting engorged breasts. I struggled with this quite a lot until I found out about that elastic band technique, and then it really helped me and I didn't suffer with any engorged breasts after that. To further reduce your chances of getting engorged breasts, you can place cold compresses on your breasts in between feeds. You can also place washed, dried and chilled cabbage leaves on your breasts. Just tuck them into your maternity bra and leave them on there for about 20 minutes. That can really help to take down any swelling that might be building up in your breasts in between feeding sessions. Regular breast engorgement can increase your chances of developing things like mastitis, so it's really important that you are aware of the signs of breast engorgement and how to deal with it if it does happen to you. And I will be doing a video about mastitis in the following weeks, so please look out for that video on my YouTube channel. Thank you so much for watching this video today. I hope that you found it useful and informative. If you've got any questions about engorged breasts, please leave me a comment beneath the video description and I will get back to you as soon as I possibly can. And if you are breastfeeding your baby, you might find it calming to listen to my breastfeeding affirmations meditation, and you can find that on my YouTube channel. See you in my next video.